Hey Rachel, so I had a chat with the MedReg. So he's given a couple of recommendations and things we can do now, as well as some stuff for the treating team to follow tomorrow as well. Now, in terms of what we can do right now, we'll try and get a urine MCS from him, just because he's at a high risk of a UTI. I think in terms of his catheter, we can leave it in place for now, because he's less than 24 hours post-operatively. Now, he's got an ongoing oxygen requirement. He's a bit tachypneic as well, so I think we should just get a chest x-ray to rule out any lung infections or any fluid buildup there. He hasn't spiked any fevers at the moment, so I don't think we need to jump the gun and pull any blood cultures. But if he does, let me know and we can come and review. When I logged in to the computer earlier, I noticed he didn't have any baseline bloods at all, so I think I'll just get some full blood count and a Chem 20. I'll send that off, but if you could log a job for me to just chase it up, that'd be great.
Yeah, I'll do that for you.
Okay. In terms of what we can do now, I know you guys are super busy, but I'm a bit concerned about him, so I think just some close visual obs. I know when we came in earlier, his nasal prong was a bit down, so if you could make sure that stays on, that'd be great. We'll keep his glasses and his hearing aids in place, just to keep him orientated. My recommendations is we keep a low light environment just to match the time of day. He's a bit dehydrated at the moment, so we'll encourage oral fluids, but if he's not tolerating it, I'm happy to chart a slow bag of IV fluids. Just because of his ongoing cardiac history, I don't want to fluid overload him. But his urine output at the moment is pretty good. I'm pretty happy with that. We'll make sure to just keep that about 35 mils an hour. How does that sound?
Yeah, sounds good. I'll make sure the nasal prongs stay on. I'll reduce the stimulus in the environment to reduce any confusion and agitation. But I'm still worried about the patient. Will he need to go back to theatre?
Oh, right, sure. I actually had a chat with the MedReg about that as well. So when I examined that area, it didn't seem like there was any masses or any bogginess. So I think at the moment we're happy with how it is, but we'll keep an eye on it. If it gets any worse, we'll have to move fast.
Yep, that sounds good.
Also, I know Mr. Anderson wasn't complaining of any pain, but I did notice he was grimacing a little bit during our review. So it'd be great if we could get his nighttime paracetamol given to him, just because pain can be a bit of a contributing factor towards delirium. Now, I had a look at his medication chart as well. It seems like he's on some regular opioids. I'm not sure if that was started in this admission or whether that was something he was on the community, but I've written a little note for the treating team to consider reviewing this because it could be a factor towards delirium as well. Now, as far as what we can do tonight, I think we should just do some serial 480s, and if we could get a bowel chart, that'd be great. I've also written a little note for the treating team to consider Jerry's or a psychiatric assessment as well, just because we don't have those services now, so it'll be a daytime thing to do. Hey, Mr. Anderson, so a bit of an update to your plan. Essentially what we're going to do is we're going to take some bloods from you, we'll take a urine sample as well, and send you off for a chest x-ray. I'll chase those results up, and if something comes up, I'll let you know. But if not, we'll just let you rest for now because you've had a pretty big day, and you'll see your normal surgical team in the morning, okay? In the meantime, can we get you something to eat?
Now that you mention it, I'm quite hungry actually.
Okay, we'll get you something. So I think we have a pretty good plan in place. We'll send him off for that chest x-ray. I have a couple of jobs piling up, so I've got to head off. But if you're concerned about anything, just give me a buzz.
Definitely.